In this video, I'm going to talk about study tips and study skills as they apply to this lab, because what I find is students have challenges with the material in this lab because they don't really know how to approach studying the material for this lab, because in this lab you're tested differently than, say, you are on a written examination where you have multiple choice questions or you have true and false or something of that nature. And it really requires a type of approach to studying that allows you to master the material. And when we say master, it means that you learn it to the point where you can actually explain it to someone else or actually teach someone else. So I want to start our discussion by asking this question: should how you study be determined by how you will be evaluated or tested? Should how you study be determined by how you will be evaluated or tested? In order to answer that question, let me pose another question. How did you study for the road test for your driver's license? I'm assuming, of course, you have a driver's license. If you do, more than likely you had to pass a road test where you actually got in the driver's seat and you had to drive um, a few blocks with an evaluator in the passenger seat. How did you prepare for that road test? Well, more than likely you prepare for that road test by practicing driving with parents, friends, etc. Right? So how you were going to be tested determined how you prepared for that test. You didn't prepare for the road test by watching a presentation, or prepare for that road test by reading a book, or uh, making a diagram. You prepared for that test by driving because you knew that you were going to be tested on your driving skills. You want to apply the same principle to this class. How you prepare for your quizzes and exams needs to be determined by how you're going to be tested. So let's look at that. So on your quizzes and exams, you're going to be asked a question or asked to provide an answer and shown an image or a model, such as this one here, where here's a little arrow pointing at a body region and you're asked to name the body region. Or an image like this, where you're given a star and you're asked again to name the region. Or name the organ system. And you have to be able to identify these regions or organ systems without the benefit of a word bank. So you have to know that this is the brachial region, that this is the epigastric region, and that this organ system, which includes all of the skeletal muscles, is the muscular system. And so this is how you're going to be tested on your quizzes as well as your lab exams or lab practicals. So you know how you're going to be tested. Let's talk about and discuss how you should prepare for this type of test. So if you're going to be tested without the words in front of you, do you want to study with the words in front of you? Absolutely not. If you're going to be tested without a word bank, you want to study without a word bank. Now, of course, when you first start learning in this example, all of these body regions or body landmark terms, because you're learning something new, you have to study with the words in front of you as well as the image. But as quickly as possible, you want to move from this to this, where you can't see the words anymore and you're able to start identifying these different body regions from memory. So you want to be able to say cranial, well, excuse me, it's not cranial, frontal, orbital, nasal, buccal, oral, mental, cervical, etc., etc. You want to study like that because that's how you're going to be tested. If you study with the words in front of you all the time, and then you allow me to test you without the words in front of you, it's like studying with training wheels on, and the first time you're tested is the first time the training wheels come off. And if you had training wheels on your bike, you know the first time those training wheels were taken off, you didn't go very far, right? Uh, so you want to study with the training wheels taken off, that is without the words in front of you, as much as possible, because that's how you're going to be tested. One of the biggest challenges students have with this course is there's so much you have to learn, and you have to learn it quickly and efficiently. So let's talk a little bit about how to do that. Let's say you have to learn, as you do, all of these body regions or body landmark terms shown here, or almost all of it. Like, this is a lot of information, and you need to learn it, like, within 5 days or so, or let's say 7, because you have, for the most part, 7 days from when we have lab to when you have your lab quiz is due. So how do you approach that? Do you wait till the day before you take the lab quiz to sit down and have like a marathon session and try to learn all of these terms? Not something I recommend. Do you learn these terms in alphabetical order? Because if you look in your book, they're listed in alphabetical order. Again, it's not something I would recommend. So first, take the approach of eating an elephant. If I asked you, how do you go about eating an elephant, right? Elephant is huge. How are you going to, if someone said, hey, you have to eat an elephant, my response would be, I will eat it a bite at a time. I can eventually finish the elephant. I can't finish the elephant at one sitting, right? I can't eat that much. But if I have a few bites a day, eventually I can consume that elephant. And so you want to take the same approach to studying all this material. So if you know you have to learn all this material in, say, 5 days or so, then day 1, just focus on the body regions that are on the head. And then day 2, you come back and you cover up the body regions of the head and see how many you can name, how many you remember. Any that you can't, you review them. Then you study the next set. Day 3, you come back again, cover up these words, see how many you remember. Any that you can't, you review, and then you study the new. Day 4, same thing. Cover up these, see how many you can identify without the words in front of you. Review any that you can't, and then add a few more. And so every day you come to study this image, you're reviewing the images, the words and terms you've already studied, and you're adding a few more. Reviewing, adding a few more. Reviewing, adding a few more. And notice I am studying from one end to the other. And by taking that approach, eventually you'll see a mental picture of this image. You'll see this image in your mind's eye, and that's going to really help you learn these anatomical terms. So study from one end of a model to the other in some kind of logical fashion that allows you to see that model in your mind's eye. And also study a little bit at a time. Study a little bit and always review the material from the previous session, testing yourself on that material to see how much you learned before you move on to the next. We learn by repetition, so the more you do something, right, the better you are at recalling it. Right? That's what they mean when they say practice makes perfect. If you do it enough, you become proficient at it. Another study tip is, as you are learning the various structures, make sure you know what you are studying. And this is what I mean. So when you sit down and you study these terms here, cephalic, orbital, thoracic, pelvic, etc., these are body regions and body landmark terms. In this image here, you're shown body cavities. So you have the thoracic cavity, the abdominal cavity, pelvic cavity. All of this together is the ventral body cavity. Just these two cavities are abdominal pelvic cavities. Cavities are spaces containing organs. And the term proximal is a directional term. So why is it important that you know that proximal is a directional term, that these are cavities, and that these are body landmarks? Well, often I will include these words in a question. Like I could point here, and if I'm looking for femoral, I will say name the body region or name the body landmark term. Or if I'm having you use directional terminology, I'll say use directional terminology to complete the following sentences, such as the shoulder is blank to the wrist. If I ask for a directional term, the answer cannot be acromial or deltoid or thoracic. If I ask for a body region or landmark term, the answer cannot be transverse or sagittal, because those are sections. And I get students who give answers that have been disqualified by terms in the question, right? So make sure you that you know what you're studying. Don't just memorize this material and don't take a step and not take a step back to say, okay, what are these things called that I'm studying? Okay. Otherwise, it can sometimes be confusing on a quiz or exam, because you're not sure what I'm asking for, because you don't know what all these terms that you're learning are actually called, right? You can't classify them. I also want to encourage you to study from the model or image to the word, and not from the word to the image. And let me explain what I mean. So I already mentioned that you should be using unlabeled images and models, or at least get there as quickly as possible. What I have seen students do in the past is they'll take an image like this without the words, but then they'll use their study guide as a word bank. Not necessarily on purpose. I don't even know if they really realize what they're doing, but they'll say, okay, I gotta know cranial. Here's my unlabeled image. This is cranial. Frontal, this is frontal. Orbital, this is orbital. Nasal's on my list. This is nasal, right? And they study like that. And they study like that exclusively. The problem is, again, when you are tested, you're just going to have this unlabeled image without a word bank. So do not study like this. I've seen students study like this, and they always run into trouble on the practical, because they're used to having the words in front of them, and they're able to identify all of these body landmarks as long as they have that word bank, and they think they're good. And then the practical comes and it's trouble. So instead, study like this. Have the image without the words in front of you at all, and see how many body landmark terms you can identify, like cranial, the part that surrounds the skull; frontal, where the forehead is located; orbital; nasal; oral; buccal; chin, mental; cervical; acromial; deltoid. After you've named everything that you can think of, you can always consult the study guide, see if you missed something, right? Something you didn't think of. But don't identify structures with the words in front of you. I guarantee you it will not, it will give you a false sense of security, and you will not do as well on the quizzes and exams uh, uh, as you thought you would have done. I also want to encourage you to use your body like a living model. You are learning the anatomy of your own human body. So, any structure that you have to know that you can find on your own body, touch it and say what it is. And say the words out loud. If you can see it, touch it, say it, and hear yourself say it, it really increases the retention. That is what you remember. Okay, involve as many senses as possible. Do you remember when you were a kid and they did head, shoulders, knees and toes, right? They did that not only because it was cute, which it was, but because they understood that involving as many senses as possible in the learning process increases how much you remember. That is, increases your retention. I want to stress how important it is that you can pronounce these words correctly. If you cannot pronounce these words correctly, you're not going to be able to learn them and identify those structures on a model. A lot of students want to skip that step. It's like, oh, I can't pronounce that word, and they just move on. If you can't pronounce it, you're not going to be able to learn it, and you're certainly not going to be able to spell it on an exam or quiz. I had some challenges pronouncing some of these words when I first started teaching this class. And so what I did, I went online and found some pronunciation links where I could type in the word, it would pronounce it correctly, and then I could learn to pronounce it correctly and also learn to spell it correctly, which is important as well. So I've provided a couple of links for you, and you can find them under course resources. However, most of these terms, you can just Google them, and Google will pronounce them for you as well. Once you're able to pronounce them correctly, it'll be much easier to spell them and to identify them on a model or image. So as I mentioned, you are expected to master the material in lab. So in other words, learn it to the point where you can actually explain it to someone, like your mom, your dad, your sister, your brother. Mastery is a journey. It takes a little time to get there. You start by familiarizing yourself with the material, right? Your online pre-lab is designed to familiarize you with the material before you come to lab. And then when you come to lab, you will be using the keys to the models, your study guide to identify the structures on the models or on your own body, like you did this previous during lab this first week, right? You were familiarizing yourself with the material. And then on Quizlet, they have a couple of activities such as matching, test, and learn, where the images and the words are in front of you and you have to match them up, or they're a multiple choice question and you have to identify the correct one. You can use all of these activities for familiarizing yourself with the material, but not really mastering the material. But it's a good place to start. After you familiarize yourself with the material, then you want to start mastering the material. If you take an unlabeled model or image and point to the different structures and say what those different structures are, or body regions are, or cavities are, without the words in front of you, then you're starting mastery. If you sit down and draw an image from your head and label it from your head, that's mastery. If you're able to touch different parts of your body and say the names of those body regions or structures or cavities or bones, etc., again, without the words in front of you, that's mastery. In Quizlet, using the the learning activities flashcards, where you have the image in question on one side, you give the answer and then you flip it over to see if you got it right, or where you're shown, or right when you're shown the image and question and you have to type in the answer and then it tells you if you got it right or wrong. That's practicing and studying for mastery because the answers are in front of you. Okay, so you can start at familiarizing yourself with the material, but eventually you want to move toward mastery, where you're using unlabeled models, or you're drawing something from your head, or you're touching different parts of your body and saying what those and identifying those parts of your body without the study guide in front of you, or using flashcards and write if you're using Quizlet. I just want to mention that Quizlet is an excellent resource, but it does have some shortcomings. For example, it will not allow me to input multiple answers. So anterior and ventral is the same, but for some of the answers I might have anterior, others I might have ventral, others I may have anterior / ventral, or anterior or ventral, and the computer is only going to take one right answer. So in some cases you may give anterior and the answer is ventral and it counts it wrong, and you just have to sort of override it, right? Understand, like, oh yeah, Chuck put in ventral as the answer, but either one is fine. And then some of the study activities, the images are so small they're very hard to see, such as in test and match. So those are some of the shortcomings of Quizlet. Quizlet is a wonderful resource for studying and mastering the material, but it should not take the place of the Learning Lab. It should complement it. The Learning Lab, working and studying in the working lab, preferably in study groups, is the best way to learn the material, because you're going to be studying from the same models, bones, skeletons that you're going to be tested from. So get into the Learning Lab whenever you can and get your hands on the models and touch them and say what they are. Test yourself. Demonstrate to other people. That is the best way to learn. I'll be taking you down to the Learning Lab this coming week so that you see where it is and you know how to get the models that you need when you need them. And that's all I have, my friends. I'll see you in lab.